Today, we will be pitching As Needed. Allow me to introduce you to Mrs. J, who was recently disabled, lost her job, and has no health insurance, and somehow still needs to care for a 5-year-old son. A social worker takes on Mrs. J's case and then tries to connect her with social services and community resources that she needs, including housing, employment, healthcare, and much more. In the US, there are millions of Mrs. J's, each with individualized and urgent needs. However, social workers are overworked and under-resourced as a profession. They aren't able to help all the Mrs. J's. In fact, it is estimated that social workers spend 2 hours on paperwork for every 1 hour of client interaction. For each referral, social workers fill out a separate eligibility form requiring input of the same information repeatedly. They also spend hours searching for potential resources, verifying that the resources are still active, and accepting new clients. These redundancies result in a growing waiting list of clients. As Needed delivers an all-encompassing social services platform designed to support social workers in identifying resources that their clients need as needed. We aim to streamline the workflow of social workers to ensure that they can dedicate more energy to their clients. As Needed automates paperwork, offers client-specific resource recommendations, and provides an easy-to-use client dashboard to manage more clients more effectively. Users need only complete a standard form. As Needed automates the rest. We filter and suggest specific partnered services, and users can track each of their unique client services, referrals, and applications using the client dashboard feature.
As you can see from the data on this slide, the need for efficient social service resource access and referrals is immense. The existing number of social workers of 826,000 doesn't nearly cover the number of requests that come in through the 211 helpline. The majority of these social workers work for large private organizations, either for nonprofits or for hospital systems. As Needed plans to capitalize on these consolidated networks of social workers to drive adoption of the platform. We are a mission-driven team and promise to never charge social workers or their organizations for using our services. In order to sustain this promise and our business, we're leveraging a two-pronged go-to-market approach by targeting health systems, who employ around 1/3 of social workers in the US. By using this B2B2C approach, we hope to generate revenue that can allow us to continue offering our solutions to social workers at no cost. Despite the great need for solutions supporting social workers, there are only a few competitors in the market. The few that do exist specialize only in a component of the social service landscape. There are community clinics and platforms, medication adherence platforms, and social service data analytics platforms for health systems. However, none of these solutions aim to bridge the gap between holistic approach of the social services system with the specialized solutions itself. As Needed aims to act as a conduit to support social workers in providing holistic client care.
Brought together by our passion for public health through Johns Hopkins' MPH and MPH MBA programs, our team is comprised of healthcare professionals with varying backgrounds. We have experience as clinicians, consultants, investors, researchers, and entrepreneurs. For our first year of operations, we plan to finalize our MVP by June of 2023 and test it with social workers in Baltimore and secure social services and community resource partners in Baltimore. In year 2, we hope to land a contract serving the City of Baltimore social services organizations and continue with community building and implement user feedback we gathered in year 1. And finally, in year 3, we plan to expand into the rest of Maryland and Washington, D.C. and test our B2B2C revenue model via health systems. We hope to leverage the FFU funds to hit our year 1 milestones and begin forming community partnerships, prototyping our solution, and conducting user research interviews with the social workers we aim to support. And with that, thank you so much for listening. Help us bring As Needed to our communities so that social workers are able to access the resources their clients need as needed.